we all know striking is a last resort, but we feel like it's crunch time, isn't it? It's crisis situation. NHS workers need everyone's support in pushing forward with this, because we can't allow this government to abuse the goodwill of staff any longer. We've been left to deal with the repercussions of a decade of cuts. But this investment's about safety, it's about standards, and it's about the health of our workforce, who so often they just put their patients' well-being above their own. And, when I say we have to force this government, we know we have to force them because we know they don't listen to the concerns. Arguably, I'd say because they don't care, and they've got other plans for our health service, which we know, which is quite clearly evidenced in the Health and Care Bill, which, as a nurse working in NHS, the threat of the bill giving even further powers to the Health Secretary, equaling less control for the NHS, is simply quite terrifying. And as an NHS worker, there's so many concerns in this bill. There's talk of diluting our skill mixes, down-regulating our professional bodies, which could implicate staff moving across trusts and filling those gaps in staffing. There's no move to bring back contracts in-house, which is really disappointing for us and our colleagues who are outsourced. There's nothing in the bill which will increase staff numbers, improve paying conditions, and ultimately relieve the stress of staff, not just caused by the pandemic, but by these years and years of underfunding. And the stress caused by this basically unnecessary reorganisation on top of everything else, it's going to only further impact the mental health of our nurses, our doctors, our support workers, everyone across the service, as well as removing any sort of democratic accountability and opening the door for further privatisation and bigger profits for companies who've already profited throughout the pandemic. They've made billions out of this crisis. And at the same time, for us, we're threatened with the destruction of our national terms and conditions. And ultimately, the bill is going to solve none of the real problems in the NHS, which is lack of resources and lack of staff. And that's what needs addressing.